Let's bring in Jean-Paul Soucy now, co-founder of the COVID-19 Canada Open Data Working Group. Jean-Paul, great to have you back on the program. I want to almost take us back to one of our first conversations when we were talking about the trajectory of this virus, but I want to throw now in those 4 variants that we've discovered in Canada and your take on what you're seeing happening here.
Yeah, so in many ways we're seeing twin pandemics here. So we're seeing that the old variant of COVID is going down at the same time that the new variants of COVID are growing exponentially. We still don't have a great handle on just how prevalent these variants are. We don't have a ton of testing across Canada yet to actually tell us exactly how far along we are in terms of these variants taking over, like they have in places like the UK. But certainly they're going to complicate the months ahead.
Yeah, they certainly are. And now there's talk of a potential third wave as we inch towards the new season of spring. Do you think that's quite likely?
Yeah, so if we look at the latest federal modeling numbers, I think it's important to remember that the purpose of these models are to kind of illuminate the choices ahead of us. I don't think anyone believes that here in Canada we're going to let it get as bad as those projections say it could possibly be. Mm-hmm. But let's look, for example, at Newfoundland, which recently had a meteoric rise in cases that was spread by these variants, and they responded by very quickly locking down. I don't know if every jurisdiction would be quite as quick or as prudent as that. But I think basically what it boils down to is whether Canada's mass vaccination campaign this spring will start in the context of a full-blown third wave or just a mild resurgence.
And speaking of that UK variant, that's what we've been seeing most predominantly in Canada. Do you think that could become the dominant strain? That coupled with, we know now as we're understanding a little bit more about COVID-19, in order for it to continue to survive, it continues to mutate in order for it to, I guess, throw us for a loop, if you will. But do you think the UK variant, that particular one, is really showing the most dominance here? Or could things change and we could be focusing now on the South African variant?
I think based on the limited data that we have, particularly in places like Toronto and the GTA, it certainly seems that we're well on our way for that B117 or the UK variant becoming the dominant strain of COVID-19. That being said, if we look at the situation in the UK back in November, right when they were kind of seeing the upswing into their really massive third wave in that country, our prognosis looks a lot better here in Canada because, of course, we have the spring and the summer coming. We can spend more time outside. A lot easier to control COVID in those circumstances. Mm-hmm. And also, of course, we have our vaccination campaign coming, and that will mean that we'll have a lot of the vulnerable populations protected by those vaccines. But again, do we want to start that campaign in the context of a third wave, or do we want to start that campaign in the context of a mild resurgence? I think that's the question that's ahead of us.
Yeah, and one that, of course, hopefully we're not still grappling with as things sort of start to swirl again out of control. Jean-Paul Soucy, co-founder of the COVID-19 Canada Open Data Working Group. Always great to have you on the program to get your insights on this, Jean-Paul. Thanks again.
Thanks so much for having me.
You're welcome. After the break.